All right, good afternoon, everyone. I'd like to thank you all for joining us, joining this webinar for the JPAL State and Local Innovation Initiative, and for taking the time to be with us this afternoon. My name is Steven Ryan, and I'm a Senior Policy Associate with JPAL North America, and I'm joined today by Sara Heller, who is a professor in the Department of Criminology at the University of Pennsylvania. Professor Heller is also a JPAL affiliate. And today we'll be telling you more about our State and Local Innovation Initiative and how our initiative will support state and local government leaders who want to tackle challenging policy issues using randomized evaluations. We'll also discuss what a collaboration between a researcher and a government looks like from start to finish. And you'll also get the chance to answer questions, to get answers to your questions about our initiative. Now here's a quick look at the agenda for today's webinar. We'll be taking questions for the Q&A through the chat box, which is located on the right side of your screen. If you have a question, feel free to send it in through the chat box at any time, and we'll respond to as many of the questions as we can after the presentation. So I'd like to start by giving a brief overview of JPAL. As some of you may already know, JPAL was founded in 2003 as a research center based in the Department of Economics at MIT. JPAL stands for the Abdul Latif Jameel Poverty Action Lab, and our mission is to reduce poverty by ensuring that policy is informed by scientific evidence. Now, JPAL's specific focus is on using randomized evaluations to answer policy questions, and each dot on this map represents a randomized evaluation led by one or more of JPAL's affiliated researchers. Now, to date, JPAL affiliates have led more than 680 ongoing and completed projects in over 60 countries, and we now have 6 regional offices throughout the world. And you can see the location of those offices. They're situated in different universities in different countries. I sit at JPAL North America, which is also located at MIT here in Cambridge. Now, while our State and Local Innovation Initiative is something that's new, we're actually building on the experience of our affiliates who've already had extensive work and collaborations with state and local governments across the U.S. Professor Heller is one of these researchers, and she'll be talking later on in the presentation about her work with the City of Chicago to find out which policies are most effective in reducing crime. Now, as an organization, JPAL works to improve the effectiveness of social policy through 3 core activities. The first activity consists of the evaluations that I just mentioned on the previous slide, and these evaluations are led by our affiliate researchers who are supported by JPAL's professional staff. The second activity is policy outreach, which generally takes place either before or after a randomized evaluation is conducted. So on the front end, we connect researchers and policymakers who can design and launch new evaluations. And on the back end, we share the results of these evaluations with other policymakers and stakeholders. The third activity that JPAL is involved with is capacity building. And we help policymakers become more informed consumers of evidence, and we equip them to partner with researchers to undertake evaluations. Now, in speaking with state and local leaders over the past 2.5 years since JPAL North America launched, we know that governments around the country are already actively innovating and experimenting with new approaches to address complex policy issues. But we also know that it's often the case that these state and local leaders have to make decisions without the benefit of rigorous evidence about which programs have been tried and proven effective elsewhere, or about what kind of impact programs in their own jurisdiction are having. Now, the goal of the State and Local Innovation Initiative is to assist U.S. governments in using randomized evaluations to generate new and widely applicable lessons about which programs work, which work best, and the reasons why. Now, through this initiative, selected state and local governments will receive technical support from JPAL staff who can help develop feasible and policy-relevant evaluations, flexible funding to help get these evaluations off the ground, and partnerships with experienced researchers from JPAL's network who can implement the evaluations. While JPAL's mission is to alleviate poverty by promoting evidence-informed policy, we define this mandate very broadly. Our affiliated researchers have interests across many different sectors, including education, labor markets, healthcare, crime, housing, among many others. For the State and Local Innovation Initiative, we're interested in the questions that are of highest priority to policymakers, and we would invite you to submit what questions you have in a letter of interest. Now, I'd like to spend the next few minutes talking about how a randomized evaluation that's currently being implemented in partnership with JPAL researchers is helping to address an important policy issue. In this case, the rapidly rising healthcare costs in the United States. Now, these costs have increasingly put pressure on patients, employers, and government budgets, but analyses of healthcare spending in the U.S. have actually found that a small proportion of patients, around 5%, account for more than half of the costs of healthcare. These 5% of patients are known as superutilizers, and they typically have multiple chronic conditions and complex physical and mental needs. Often, these patients fall through the cracks of the healthcare system, and they end up repeatedly going to the emergency room and being admitted to the hospital rather than receiving the preventative primary care and social services they need to be in better health. Now, a decade ago, Dr. Jeffrey Brenner, who is a physician who was practicing in Camden, New Jersey, founded the Camden Coalition of Healthcare Providers to tackle some of the root causes of superutilization of healthcare. Now, the Camden Coalition has gotten a lot of attention for its innovative work, and Dr. Brenner has received recognition and awards such as the MacArthur Genius Grant because of his work and leadership of the Camden Coalition. The Camden Coalition's signature program is known as Link to Care, which uses a data-driven process to identify superutilizing patients with complex needs. These superutilizing patients are then paired with a team of support workers who can help them make their doctor's appointments, sort out their prescriptions, sign them up for benefits and services, and in some cases, they even help find them stable housing. Now, initial indications suggested that Link to Care was improving the health of superutilizing patients while also reducing costs associated with emergency room visits and hospital admissions. But rather than rely on this anecdotal evidence of Link to Care success, Dr. Brenner decided to partner with JPAL-affiliated researchers to implement a randomized evaluation of the program. So why did Dr. Brenner decide that a randomized evaluation was needed? Why not use some other method of evaluation? Well, here at JPAL, we argue that randomized evaluations are one of the best ways to determine the true impact of a program. Other methods of evaluation that rely on observational data are at risk of either overstating or understating the true impact of a program. And to help think this through, I thought I would show this graph, which is looking at hospital readmissions over time for a given patient. And the orange line captures what we actually see in the data. And that vertical green line is the time of the intervention. So we can imagine that's when the Camden Coalition starts working with this patient. Now, how do we know what impact this intervention has? Well, there's one possibility. We could imagine that in a world where the patient didn't get care from the Camden Coalition, their health would continue to get worse and they would keep going back to the hospital. This counterfactual is represented by this blue line, and so we can think of the impact of the program as being the difference between the orange dot and the blue dot at the very end in 2015. Now, of course, we can't actually see what the counterfactual really is, and so I'm telling a story where that patient gets worse in terms of their health. But it might also be the case that the Camden Coalition is very successful at identifying those patients who are who are sickest and at their worst in terms of their health status, but those patients would actually get better on their own over time. In that case, the counterfactual would look something like this. So these patients would, even in the absence of the Camden Coalition support, still get better and be in better health. Now again, we can only observe the orange line in the data. The blue line, the counterfactual, we can't observe. But one way we can mimic the counterfactual very well is by using a randomized evaluation. And with a randomized evaluation, the control group serves as the counterfactual, and we control the outcomes of the control group to people who are in our treatment group in order to estimate the impact of a program. Now, there are 3 key steps to follow when randomizing. The first is to identify your population of interest, or in other words, all of the individuals who would be eligible to receive your program. The second is to randomly select members of this population into either your control group or your treatment group. And the third step is to deliver the program you would like to evaluate to members of your treatment group, while the control group receives the status quo. As I mentioned before, by comparing the average outcomes of interest for these two groups, we can get an accurate estimate of the impact of our program. In the next couple of slides, I'll be describing how the Camden Coalition of Healthcare Providers, in partnership with researchers from JPAL's network, is following these steps to conduct a randomized evaluation of their Link to Care program. So first, using an electronic health record system known as the Health Information Exchange, Camden Coalition staff identify newly admitted hospital patients who are potentially eligible for the Link to Care program. These patients have had 2 or more hospital admissions in the previous 6 months and suffer from chronic health conditions. Now, before the randomized evaluations, the Camden Coalition used to recruit new patients into its program on an ad hoc basis whenever there was sufficient capacity and resources to do so. But to make an evaluation feasible, the Camden Coalition changed the way that it signed up new patients. Now, the recruiting process looks like this. Once a patient has been identified as being eligible through the Health Information Exchange, Camden Coalition staff go to the patient's hospital bedside, they explain the care management initiative, they ask for the patient's consent to participate, and they collect relevant information about that patient. Now, it's only after the patient has consented that randomization occurs. The treatment group is then comprised of patients who consented and who are randomly assigned to receive the wraparound services provided by the Camden Coalition, while the control group consists of those patients who consented but were randomly assigned to receive status quo medical care. Now, I want to point out that the total number of patients who will be served by the Camden Coalition throughout this evaluation is the same as the number of patients they would have served otherwise. The only difference is that change in the recruiting process that makes it possible to see what impact the Camden Coalition's intervention is really having. Now, patients who are assigned to the treatment group receive weekly home visits from a team of Camden Coalition staff, including registered nurses, social workers, and health coaches. These home visits, along with information about whether or not the patients are attending their doctor's appointments, are recorded by the Health Information Exchange. And we have here a graph which is used as a dashboard by the Camden Coalition staff to see whether or not patients in the treatment group are being served according to schedule. Now, we often hear from service providers that people who need to make decisions have short timelines and need information sooner rather than later. And what this example from the Camden Coalition shows is that we can conduct an evaluation and gather information that can be used for things like process monitoring and short-term decision-making, but can also go on to inform evaluation results about what impact a program had. Now, the primary outcome of interest for this evaluation are the number of hospital readmissions. And this information is recorded by the Health Information Exchange. But there's a number of other outcomes which are also of interest both to the Camden Coalition as well as to the JPAL affiliated researchers who are working on this evaluation. And the nice thing is that this information is already being collected by different government agencies at the state and federal level. What this means is that instead of having to spend money and time collecting information through surveys, the Camden Coalition can simply focus on delivering the highest quality of care, while JPAL research staff deal with signing the data use agreements, access and analyze the data from administrative records. And we're able to look at things like healthcare use, whether or not people are participating in different government benefit programs, as well as their earnings and employment rates. Now, I've been talking a bit about an evaluation that is still ongoing, but I'd like to invite Professor Sara Heller, who, as I mentioned before, is at the Department of Criminology in the University of Pennsylvania, to talk a bit about one of the projects she's been involved with in collaboration with the City of Chicago. Now, Sara, if you wouldn't mind, I'm sure everyone is really looking forward to hearing more about this, this work that you've done, so please take it from here.
Thanks so much, Steven. Can you hear me okay?
Yes, we can.
Great. So thanks everyone for joining us, and I'd like to thank JPAL for giving me the chance to talk to you about this project. You know, I myself feel like it's really important for academics to help you all as practitioners get the answer you need. And so in that respect, you've taken the first step by joining the webinar, so good work. I'm going to try to give you a little bit more of a flavor of what these kinds of projects entail and what it looks like in our context in Chicago. And I know a few of you had joined the previous webinar and so heard a little bit about this project from our policy partner, Evelyn Diaz. I hope that hearing about it again from the research side will give you a different kind of insight into the project, and then I look forward to hearing your questions afterwards. So Chicago spends about $36 million annually for after-school programs and summer employment. And some of their really strong driving motivation for spending this much money is to reduce youth violence. And I'll say at the outset, I think Chicago gets a little bit of a bad rap in terms of youth violence. When you actually look at the data, it's not even in the top 10 most violent cities in terms of rates of violent crime. But it is such an incredibly tragic and socially costly problem that it's a huge priority for the mayor there and for the residents. And so they think about a lot of their after-school programs and summer employment programs as violence reduction. There's lots of reasons to think that that would work, right? That giving a kid a summer job should reduce violence. It provides income, information on how much schooling matters in the labor market, connections to employer networks. It develops various kinds of skills. And it has a sort of what we might call an incapacitation effect. If kids are busy working, they can't literally be on the street getting into trouble at the same time. But when you start to think really carefully about something like summer jobs, you realize the theory is not entirely clear-cut, right? So kids are earning money, but we're not telling them what to spend money on, and they might spend it on things that actually increase crime, like drugs and alcohol. They're also spending more time with different types of kids, going back and forth to different places, which we know can sort of create conflict sometimes. And in fact, before we started this project, there was really little good convincing evidence on the question. And so to Chicago's credit, they didn't just assume the programs they really like worked and said, we're going to keep spending money on this because this is solving our problem. They recognized that they actually didn't have very much good evidence and wanted to know for sure if they were spending their money in a way that really achieved the goal that they wanted, which was reducing youth violence, or if not, that was something important to know too, and then they could choose to spend that money on something else. So with that in mind, I partnered up with them to sort of carve out a piece of this $36 million budget, a very small piece, to do a rigorous evaluation. So what we evaluated is a program that was created for this purpose of being an experimental program called One Summer Chicago Plus. And we started designing it back in 2012 to test this key question. At that time, it was an 8-week summer program. And kids worked in government and nonprofit minimum wage jobs for 5 hours a day, 5 days a week. You can see this gentleman here being very excited about his tomatoes that they're growing in a community garden. They cleared out a vacant lot in one of their neighborhoods and learned a little bit about city gardening. All of the youth in the program get an adult job mentor, so that's at a ratio of about 10 to 1. So someone whose job it is to help them deal with their barriers to employment, whether it's transportation or family problems or conflicts with their supervisor. There's a few other aspects to the program, a one-day job readiness training, a meal a day, and bus passes. And then based on some of my other research about a different program, half of the youth worked a few hours less a day and instead also participated in a cognitive behavioral therapy or a CBT curriculum. So following the steps that Steven talked about a little bit, we first want to think about our population of interest, and in this case, it's youth at high risk of violence involvement in the city. And so we helped the city use administrative data to identify 13 high schools where we thought youth were really at a particularly high risk of violence involvement. And so the program providers went into these high schools, started inviting youth to apply, and you can see on the map of Chicago here, each green dot is an applicant. And that's overlaid on violent crime rates, and so you can see, just by sort of thinking carefully about which schools to recruit in, we did a really good job of recruiting kids living in the highest violence neighborhoods in Chicago on the south and west sides. So you probably can't count all of those little green dots, but there's a lot of them. And in fact, there's far more than we had money to serve. So we had, at this point, funding to serve about 800 youth, and we got a little over 1,600 applicants. And this is something that's really common, not just in youth employment programs, but across a lot of programs, is that they're oversubscribed. There's no way that we could ever serve all of the people eligible for the program who we think could benefit, because we just don't have enough funds, right? We would if we could, but we can't. And so we have to choose participants for the program somehow. And in the past, it had been always sort of either a first come, first served selection mechanism or something that someone might call something like nepotism, where, you know, it's all about sort of who you know and whether they can get you a job. So rather than do that, as we designed this experimental program, we thought, well, this is a perfect setting in which to randomize, because that way we can allocate this limited resource, the limited number of slots, in a totally fair way. All of the applicants have an equal chance of winning a job, and that sets us up to do a really rigorous evaluation, because rather than having to compare the people who show up at the door asking for a job to people who don't, and they might be different for all sorts of reasons other than the program, we have these two groups that in the absence of the program look perfectly identical. And so we know at the end of the day that any differences between them are going to be because of the program itself. That's sort of the key insight into what we mean by rigorous evaluation. And so that's what we did. We took a little over 1,600 applicants and entered them into a lottery. Half of the treatment group got the jobs with a mentor, half of them got jobs with a CBT curriculum, and the rest were in the control group, where we didn't have funding to offer them any extra services, but they were free to pursue any other opportunity they wanted to. And you can see here on the right of your screen a little bit of a description of who the study population was. On average, they were not quite 17, almost entirely African American, almost entirely from poor families. That's what their free and reduced lunch indicator there means. Lots of them had had an arrest record of about 20%. The school day the school year at that point was about 170 days, so kids are missing about 6 weeks of school on average in the year before the program. These are all from the pre-program year. Coming from pretty disadvantaged neighborhoods where unemployment rates are about 19%, and not very many of them had had a job in the year prior to the program. And so what we're going to do now that we've lotteried these slots, we've randomized youth to a treatment and control group, is we can track their outcomes in administrative data. And so I negotiated data sharing agreements with the Chicago Police Department, with the Chicago Public Schools, and with the state agency that keeps unemployment insurance records to be able to track these youth outcomes. So I'm going to show you the results. Now I'm going to show you them for the program as a whole versus the control group, because it turns out that the results for the jobs-only youth look a lot like the results from the jobs plus the CBT group. So I'm going to pull them together when I show it to you, but that in itself was a pretty interesting finding for the city, because it meant that whatever kinds of training was happening in the jobs-only version of the program, that was enough, that we didn't need the extra CBT curriculum, which cost a little bit of extra money, to have the same effect. So here are the main results after 16 months. Wish I could do a drum roll on the computer. Violent crime arrests plummeted, right? They went down by 43%. That's about 4 fewer violent crime arrests per 100 youth, which is a really big dramatic effect, especially given the sort of level of violence involvement in the city. Now, we didn't see any change in other types of crime, nor in any school and employment outcomes. So it looks like that really the effect of the program is to reduce violent crime, which was exactly the goal of the program, so that's a good thing. Now, one of the first questions people often ask me when they look at this is this just the incapacitation effects? Was it just because youth were busier during the summer, and then after the summer they went back to whatever they were doing before? So I'm going to show you a picture now that suggests that's not the case. You don't have to worry too much about all of the details of this graph, but the beginning is before the program started. As we move over to 3, that's the end of the program, and so you can see crime goes down a little bit. We're a little bit below the 0 line there, but it keeps going down long after the program ends. And in fact, even if you throw away data from the whole summer, the effect is still statistically significant. So kids are taking something with them after the program that's changing their behavior. Now, what that is, we're not quite sure yet. We're just going to do some more research on that. But that by itself is a really interesting and exciting finding. So this is sort of the research project as a whole, but this is not the end of the story. And in fact, what happened next, I think, is really interesting, is that we published this, and this published very well because people, A, care a lot about youth violence, and B, really pay attention to rigorous randomized control trials. And so this sort of whipped up a lot of interest from researchers, from media, from other policymakers across the country and, in fact, across the world. You can see a few of the headlines here from the Washington Post and the U.S. News and World Reports, Chicago and New York Magazine. And because that this was a really convincing finding, Mayor Emanuel, the mayor in Chicago, was empowered to seek further funding. So, in fact, he ended up getting $10 million from private philanthropists to expand the program so we can serve even more youth. And again, to the city's credit, they didn't just say, great, now we know what we're doing, we're going to serve these more youth, perfect. We're in fact continuing to research, continuing to do more randomized controlled trials as we're expanding the program, which helps us learn both about what works and what doesn't as we're scaling up the program, but also to try to isolate which parts of the program matter to sort of answer slightly different questions than just does this work at all or not, and for whom, so that the city can really figure out who they should be targeting with these programs and who might need different kinds of services. So that's about what I have to say to you. I'm sure you have lots of questions about that. I have certainly not covered all the details, and so I'll be happy to sort of answer your questions as we go through the Q&A.
Great, thank you so much, Sara. I think that's what Sara just described is really kind of the ideal kind of collaboration that we'd like to encourage more of between a researcher and policymakers. And that's really what the goal of this state and local initiative is. It is to support this kind of research that we think is really policy relevant and can be used to answer these kinds of tough, challenging issues. I mean, as Professor Heller was mentioning, you know, looking at an issue like crime, for many people that seems intractable, but the fact that summer jobs does seem to have this like long run effect, I think that's really great news, and it's something that I know many governments now across the United States are interested in learning more about. Now, as part of our state and local innovation initiative, we're going to be hosting multiple rounds of a two-phase competition for interested state and local leaders. Now, in the first phase, state and local governments are going to be able to apply for a package of resources, and this includes ongoing technical support from a team of JPAL staff, flexible pilot funding of up to $100,000 to get evaluations off the ground, and matchmaking with researchers in JPAL's network who can help design and carry out these evaluations. In phase two, those governments that have successfully partnered with a researcher to design a high-quality, feasible randomization can apply for funding to carry out that evaluation, typically in the range of between $250,000 to $500,000. Now, we wanted to make this application process as easy as possible, especially for the first phase of the competition. So all that we ask is that you submit a brief letter of interest describing how your jurisdiction would use rigorous evidence to answer an important policy question. Now, here's a quick look at the timeline. On February 16th, we have the deadline to submit the letters of interest. Once these letters of interest are submitted, we'll then take a look and see which jurisdictions have some very promising ideas, and we'll invite finalists to submit full proposals by March 14th. That's when the invitations will go out. On May 2nd, that will be the deadline for those full proposals to be submitted, and after another month of review, the winners will be announced. Now, if you'd like to hear more information or you'd like to get more information, you can go to our website, povertyactionlab.org/state and local. We have additional information there. We also have the instructions for the letter of interest, which you can download. And you can also find contact information if you'd like to get in touch with anyone on our team to ask us questions. We're always happy to have calls or to email people to talk through some ideas and to help you figure out what it is you'd like to include in your letter of interest. Now, at this point, I'd like to move on to the question and answer part of the presentation. So I know some of you have already submitted some questions through the Q&A, and I think it would be great for us to start going through some of these. One of the questions that's been asked, and which I think is relatively easy to answer, is whether there's a recording of the previous webinar. There is. As I mentioned, if you go to our website, you'll see a link to our webinar page, And from there, you can access the recorded version of the last webinar, and we'll also be uploading a recording of this webinar as well. So if there's anything that you missed, you can always go back and reference that. Now, Sara, I have a question that pertains to the One Summer Plus intervention in Chicago. And the question asks, what were the differences in the results between those who simply had the regular summer jobs program versus those who received jobs as well as the cognitive behavioral therapy?
Yeah, that's a good question. So I will say that my prior going in, because of some of my other research, was that it was really going to be the CBT driving everything, that there have been, a fair number of youth employment evaluations that have been kind of disappointing. And so I expected it all to sort of load up on the CBT, and that turned out not to actually be the case. That in terms of the violence results over these 16 months, the youth who got the job and the mentor had basically the same level of violence, of reduced violence, as the youth who worked a few hours less and had the extra CBT curriculum. And so I think that was really surprising and something that we wouldn't have been able to figure out without the evaluation. I think for me, the interpretation of that is that the combination of working with an employer who's invested in youth development and the adult mentor might teach some of the same things that the cognitive behavioral therapy curriculum does, so that you might not need this separate curriculum, but that the two kinds of activities are a little bit substitutable.
Thanks very much, Sara. I think it is a really interesting result that you're still seeing these impacts even in the absence of the cognitive behavioral therapy. And I think it's really interesting as well that there's these additional follow-up studies which are trying to find out exactly what mechanism is really causing that change in behavior that's reducing violent crime. Now, we have another question that's asking about whether or not it's mandatory to work with a JPAL researcher. Now, we're viewing this initiative as being something of a package where we provide not only this funding and this support, technical support from JPAL staff, but we also provide the matchmaking with affiliates in our network. So this is something where, if you do sign on to do this evaluation with us through the State and Local Innovation Initiative, there needs to be at least one principal investigator on the evaluation who is a JPAL affiliate. So that is part of the package that we're offering. Now, we have another question as well, which is asking about the letter of interest and whether in the letter of interest there needs to be one question or if there can be multiple policy questions. And my response to that would be that we invite you to kind of discuss as many kind of questions as your jurisdiction has. If there's a couple of different issues that you think might be suitable and might, where you need more evidence to kind of decide about your next steps in terms of policies that you'll be implementing, we'd encourage you to discuss all of those in your letter of reference, or excuse me, your letter of interest. So certainly you don't need to just pick one question. If you have several, you can include all of those. Now, we have another question about the initiative, which is asking for the timeline for the project to start. In terms of the randomized evaluation, we would like that to begin probably within a year after the winner of the phase 1 of the competition is announced. So again, phase 1, if you are one of the selected state and local jurisdictions, you will be receiving technical support from JPAL staff who can help you think through how you'd actually design and implement a randomized evaluation, and you'll also receive, or excuse me, you'll also be matched with affiliates in our network of researchers. And these affiliates will help develop a full proposal, or not a full proposal, but rather a proposal for phase 2. And we would hope that that proposal for phase 2 would be ready within a year, so that you'd be able to start the randomized evaluation within approximately a year of being named one of the phase 1 winners. Now, Sara, I have another question for you about the Chicago study. It asks, or it notes that some applicants were from low violent crime neighborhoods, and it asks whether those applicants were accepted into the One Summer Plus program, or if it was only applicants who came from high violent crime rate neighborhoods.
So we've done this a little bit differently in different years. In the first project year, which is the one I told you about, the eligibility criteria was school-based. So we picked these 13 schools, which were all in high violence neighborhoods, and invited anyone who attended school there to apply. And in Chicago, like in many other large cities, they have school choice programs, so you don't have to attend the school that's in your neighborhood, which means that some youth who are going to school at eligible schools could have lived in lower crime neighborhoods. And in fact, when we started, we didn't know for sure whether we would do a great job of targeting youth in high violence neighborhoods. It turned out that we did, that the vast majority were in these sort of higher crime areas. But that was a sort of decision we made in collaboration between the program implementers and me about sort of how to get to the population that we thought could most benefit from the program. In later years, it was we've tried different things. So in the follow-up year, which we don't have results for yet, we recruited in two different ways. One was through the justice system, so we actually asked juvenile and adult probation to refer youth to the program. And the other was based on where you actually lived. So in that case, we did use geographic areas to sort of define eligibility so that we were only getting youth who lived in these high crime areas. And so I think, you know, as you're thinking about how that applies to your own projects, you know, you don't necessarily have to decide that right away. That's something that you can sort of think about in combination with how random assignment might work, and you can collaborate with researchers that way. But I think, you know, one thing that is useful in helping to demonstrate is just sort of how you can think creatively about how to reach the populations that you most want to get to.
Great, thank you so much, Sarah. That's having someone who's had this kind of real-world experience and who can speak from the researcher's perspective. I think this is really invaluable, and I'm actually learning a lot from these questions and answers. Now we have a question here about multiple funding and research cycles and about the frequency of those rounds of funding. So right now we will be having about 2 rounds, or we will be having 2 rounds of RFPs or funding each year, but we'll also be accepting letters of interest and proposals on a rolling basis, although we can't guarantee that those letters of interest will be given the same level of consideration as would be the case for letters of interest submitted during the standard cycle of rounds of funding. I have another question here about how big is the phase 1 proposal. I think for the time being, what we want to make sure is that phase 1, or applying to phase 1, is as kind of low cost to interested state and local governments as possible. So all we ask for that first phase 1 letter of interest is really just to submit a few-page letter of interest that discusses those questions that matter to your jurisdiction. It would also be very useful if you could submit a letter of support from an executive in your jurisdiction, be that the mayor or the county manager or the governor or someone in the governor's office, that sort of thing, just that we know that you do have support from high levels to do this kind of evaluation. And then once your letter of interest has been submitted, here JPAL staff, we can help work through to figure out what additional information is needed going forward. But for the time being, I'd just like to emphasize that the letter of interest should not take up too much time, and we're not asking too much. It's really, we want to give you the opportunity to just kind of speak your mind and tell us more about, you know, what are the policy challenges that you want to tackle. Now we have, Sarah, another question about the One Summer Plus. And it's asking about what were the obstacles to obtaining data from city partners for the evaluation. I wonder if you could speak to that, just what kind of negotiations happened to get those data use agreements and how that data was handled in a way that was sensitive to make sure that you know, different privacy concerns were addressed.
Yeah, so that's definitely both a challenge and a benefit, I think, of projects like this. So basically my entire 3rd year of my PhD program was dedicated to working out all of these data sharing agreements. why I think it's so great that JPAL is offering to sort of do that part for you. That's a non-trivial offer that they're making. So, you know, as a lot of you probably know, there are a lot of laws involving who can see what data and where and in what context. And so for us, right, we have juvenile justice data, which is very closely guarded. We have individual school records, with which some jurisdictions worry about FERPA and whether they can share that with researchers. So I think a combination of things helped us. One is really having very strong mayoral support. You know, there were times when the lawyers involved were trying to say, no, 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 we can never do this. And Mayor Emanuel and his staff stepped in and said, look, this is really important to the city. We have to know if we're spending these dollars in a way that reduces youth violence. Find a way to make this happen. So I think that was a big help. The fact that I was affiliated with a university that had a lot of resources in terms of data protections was very useful. You know, we ended up setting up a very secure server that in some cases is better guarded than the people who sort of host the data themselves. We get institutional review board approval to make sure that we're protecting on the confidentiality of the subjects extremely well. We regulate who can see the data. We never, you know, transport it back and forth on flash drives. It always stays on a secure server that you can only access through, you know, particular ways. And so getting researchers who sort of have some experience with data security, I think, is also helpful. And I think one thing I learned through this process is that nothing is impossible, even though it seems really difficult and sometimes you sort of want to hit your head against the wall a bit. You can always find ways to work it out, because in the end, you know, the questions you're asking are really important and have a really big societal impact. And so that usually, if not always, can get you over the hurdles. And I will say I'm starting to do some of this in Philadelphia now, and it's the same thing, that people want to make their data available to answer important questions. Sometimes the legal obstacles trip you up a little bit, but if you sort of work creatively and think about how to de-identify data and how to maintain confidentiality, it really can work.
Great, thank you, Sarah. I have a question here which is asking about whether or not some of the funding from our initiative can be used to fund services delivered by different jurisdictions. In most cases, I don't think that the amount of funding would be sufficient to pay for a big program, but you could think about using some of the funding to pay for something that was a very low-touch intervention. For instance, if you wanted to see what impact sending out different types of letters to constituents, or seeing about you know, sending text messages maybe to people for various reasons, maybe to remind them to, you know, do something. So those are very low-cost things which you could probably pay for using the funding. But to give you a sense of what we were thinking about how you might use this funding, you might use, you know, the pilot funding that we'd be providing to cover, you know, some staff time to coordinate startup activities, or you might use it to hire a research assistant who can then link administrative data sets or determine potential sample sizes. Or you might use that pilot funding to pay for the development and field testing of surveys. Now, Sarah, I have a question here about whether control group participants were notified in the One Summer Plus, and whether or not they thought they were signing up for services but then did not receive those services. Can you talk about how researchers handle things like randomization and eligibility, and how they do that in a way which is sensitive and make sure that nobody feels like they've been cheated?
Yeah, so that's a really important thing to think carefully through. I mean, so there's all of this sort of ethical concerns, right? You want to make sure you're not taking anything away from someone that they could have, which was not the case here. But you also want to be careful about not disappointing people. And so in our case in Chicago, it was announced from the beginning how many program slots there were, and it was clear when people were applying that they weren't guaranteed a slot, that they were, by applying, they were saying, I'm interested in this program. And in fact, people knew that there was then going to be a lottery to if there were too many people who applied, there would be a lottery to select slots. I think there's lots of different ways to do that. sometimes you can just start from administrative data. So in another of my projects, we took administrative data on everyone who we expected to enroll in a certain number of schools. We randomized from the administrative data, so before anyone knew anything about the program, and then we only approached youth who had been randomized into the treatment group. So the control group didn't even know they were missing anything because it's not like they had sort of signed up expecting to get something and then felt like it was taken away. So I think there are, again, here lots of different ways to do that depending on your particular institutional setting. But it is definitely something that's worth thinking carefully about, not least because, you want to make sure that when you're estimating the difference between getting the program and not getting the program, the people who are not getting the program aren't doing worse than they would have otherwise because they're angry about not getting into the program. So I think, it is something that's really important to think carefully about.
Thank you, Sarah. And I think, in interventions like or evaluations like the one that's ongoing with the Camden Coalition, they've put a lot of thought into ways in which they can, recruit people and consent them and do randomization in a way that's sensitive to the fact that, some patients may not get the service even after they've had this interaction with the Camden Coalition care providers. And there's a lot of work that's been done out there, and it's definitely something where we listen to service providers to get their feedback in terms of how this can be done in a way that's sensitive and make sure that nobody leaves feeling like they've been mistreated.
And Steve, can I, just one more thing that I think might be relevant here is that sometimes randomization can even help with that. So in our case, what had happened before we started randomizing is oftentimes youth would apply, and then service providers would pick who they were going to serve. And then it ended up that the people who were not getting served because there weren't enough slots would have to be told things like, well, someone else was more qualified than you, or we know this person better than we know you. And that can be incredibly disheartening. Whereas in this case, what they could say is, I'm really sorry, this is just luck of the draw. It has nothing to do with who you are and what your skills are. We just ran a lottery. And so in fact, even though the providers had some resistance at the beginning to random assignment, in the end they ended up really liking it because it was much easier to explain to people who were not going to get a slot why they didn't get it.
That's a really good point. Thank you, Sarah. Now I have another question here, which is asking about how much evaluation needs to be done during phase 1 of the initiative. And phase 1 is really an exploratory phase. It's for people to kind of think about what randomization would look like in practice, what data is available, how how the service would be delivered in such a way that it would be both true to the program's intent while also being delivered in such a way that we could, detect the program's impact. So really, there's not as much evaluation going on at that point. There might be some initial survey taking just to see whether or not, if surveys are being used, whether those make sense and the questions that they're asking are understandable. But really, the evaluation itself will happen once phase 2 starts, and that's when you have the affiliated researchers who have all that experience, they're on board. You have this additional funding where you can actually start implementing the program. And that evaluation, the amount of time that those evaluations take, it really depends on what questions you're asking, what your outcomes of interest are. So there's no real hard deadline for when those evaluations would be completed. So it's basically phase 1 is all about kind of designing and exploring ideas, and phase 2 is once you have that design in place, actually implementing it. Now we have another question asking about data sets and how JPAL can help in finding, accessing new data or putting different data together. So as I mentioned, one possibility is that you can look at using things like surveys to gather new data. Unfortunately, that can be costly and time-consuming, but there are certainly different interventions which have used survey collection as a way of gathering data. But JPAL also has a lot of experience doing things like matching data sets. So, if you have some personal identifier like a social security number, you can use that to match individuals across many different data sets like, education records or criminal justice records or healthcare records, and you're able to kind of construct an entirely new data set which didn't exist before. And our research staff here at JPAL, they have a lot of experience doing that. They have a lot of experience negotiating those data use agreements, which Sara was just talking about. So that's definitely something that we can help you think through and start those discussions with the relevant authorities to make that access happen. Now, I have a question here about how standardized an intervention has to be and whether it's possible to study a program that can have different variants. And I think that's certainly possible. And I wonder, Sara, if you could talk a bit about some of the different variants of the One Summer Plus program that have been tested and maybe are being thought about tested, and how having those different variants are letting you kind of get at some of the underlying mechanisms of what's causing this drop in violent crime.
Yeah, so I think there's sort of two versions of that question. One is the one that you're asking about. So, you know, if there's sort of two versions of a program, and you can actually leverage that to make an even more exciting research design, which is to try to answer the question of what is the effect of adding this piece or doing this piece instead, and sort of set up the random assignment to be able to answer that question directly. So, you know, if you have a couple different versions of the program, that's something that you can leverage into an even more exciting proposal, I think. But if the question is more that, you know, the intervention is a little bit nebulous, or, you know, there's 20 different versions, and depending on who you are, you get a different version, that's something that's sometimes a little bit more challenging in the experimental world, but not impossible, because, you know, there are these, people like to call them adaptive interventions, where, you know, if you are case A, then you get treatment A, and if you're case B, then you get treatment B, and then if you're A and have another thing, then you have a different type of intervention, and if you're B and you have another thing, then you get a different type. That is also something you can sort of incorporate into research designs to look at the effect of what is the effect of giving these kinds of adaptive interventions, where you try to suit things to people's needs. That said, I think you do want to make sure that you can define what the intervention is. If something is sort of so nebulous and has so many different pieces that if you're saying, you know, we want to know the effect of X, and you can't really say what X is, and that might be a situation where you need to spend a little bit more time thinking through what you really think the key pieces of X are that you want to evaluate.
I think that's a great point. Thanks so much, Sara. We have another question, which is asking about whether or not somebody who, or a jurisdiction which is still in the process of getting some waivers finalized, or working through to get some federal waivers put in place, whether or not they should apply, even if that process has not been finalized. And my response to that is definitely yes. We understand that there are many different pieces that have to fit together before an evaluation can take place. But we also understand that it's very hard for jurisdictions to put those pieces together on their own, and so that's really the point of this initiative, is for us to give you support as you're trying to make sure that, you know, all of the T's are crossed and the I's are dotted. So, you know, even if there are things that are in place that you would have to negotiate agreements with or get waivers for, certainly don't let that stop you from kind of sending us a letter of interest and talking about what you would like to do. And we would certainly be happy to work with you to kind of sort some of those details out. Now, I just wanted to address a few more questions before we wrap up here. So as I mentioned, you know, one question we've gotten and we've heard from today is whether or not it's possible to evaluate entitlement programs. This is something that it is possible to evaluate these. In the cases where people have, you know, there's no way we can deny access to an entitlement program because that's written in the law. But in many cases, people aren't actually taking advantage of the entitlements which are theirs by right. And so in those cases, what we can do is we can encourage some people randomly to take up those services. And because of this encouragement, if people do respond favorably and they decide to sign up for different benefits or services, we can then estimate what impact those programs have. And that does not require that we deny anybody access to programs to which they are guaranteed access. And another question asks whether or not PowerPoint slides will be available. And just as I mentioned, with the webinar recording being posted online to our website, the PowerPoint slides will also be posted in PDF format. So if you'd like to download and share those, they will be available shortly. Now we're getting to the end of our time, so I'd like to thank Professor Sara Heller again for taking the time to speak with us today and to talk about her really fascinating work with summer jobs programs for youth. So Sara, thank you again, really appreciate it. And I'd also like to say to any of you who are participating in this webinar, please feel free to contact us. You can get our contact information at the website. If you have any follow-up questions that you'd like to ask, we're more than happy to talk with you. As I mentioned before, we can talk about things on the phone or via email, so please feel free to reach out. I'd like to thank you all again for participating, and I hope you all have a great afternoon. Thanks very much. Bye-bye.